Welcome to a CNBC Africa panel special conversation regarding tech health and the e-health space. Now, the COVID-19 pandemic has impacted the growth of Africa tech health sector, with many companies in the space seeing an increase in digital adoption. Now, as a result of the imposed lockdowns and curfews that have happened recently, the impact on movement seemed to present an opportunity for business in the tech health space. A year on, could this have a lasting impact on the consumer behavior in the health industry as we knew it? Now, to introduce our panel of experts who are going to help break these down and much more, allow me to introduce Rita Kanyana. She's the Senior Strategy and Operations Lead at Babylon Health Rwanda. Dr. Davis Musinguzi is the Managing Director of Medical Concierge, the people behind Rocket Health out of Kampala, Uganda. And Jane Kula, she's the Country Manager of Helium Health in Kenya, quite the company that has expanded into that space there in Kenya. Thank you for making the time, ladies and gentlemen. And, allow me to go with ladies first. Rita, when you look at what has happened over the past 1 year, for Babylon Health, has this changed the way consumers are approaching e-health and approaching your services?
Thank you, Arnold, for having me. To answer your question, that is absolutely right. Since the start of the pandemic, we've seen tremendous changes in our customer behavior. I'd say at the start of last year, we were averaging about, let's say, 3,000 consultations in a day on our digital platform. But as we speak today, we're at about 6,000 a day. So it's almost a double, an increase by 100%. So we're indeed seeing a big change in how things are happening and how consumers are embracing digital health services. That is so true. Mm-hmm.
So quite the good news for you there. I just want to bring Jane into the conversation. JaneHelium has recently expanded into Kenya, I believe from Lagos. Correct me if I'm wrong there. What's the reason, one, behind that expansion? And do you believe consumer behavior has changed for the good?
Thank you, Arnold, for having me. Glad to be on this panel. And indeed, yes, our headquarters are in Lagos, Nigeria, expanding across into East Africa with Kenya as the entry point. And definitely, just like Rita has said, I'd like to echo that. We've definitely seen an increase in the uptake of digital health. We went from serving, just a few hundred facilities, and now we're in over 500 facilities. That, translates to roughly about 7,000 healthcare workers and, 300,000 patient monthly visits. So we're definitely seeing a lot more use of our platforms, electronic medical records, telemedicine. That's something we launched last year, and we've seen the uptake really skyrocket. And in terms of even just how we have been able to operate as a company, being able to deploy, to launch during COVID, we've been able to do that even in the midst of a pandemic. So definitely seeing an increase. Yeah.
Thank you there, Rita. Davis, Dr. Davis, I want to bring you into the conversation. Rocket Health has, been one of the biggest beneficiaries of this, without a doubt, especially going by your recent tweets. But before we get into that growth, and you to piggyback off what Rita and Jean have mentioned to us, I just want us to paint a picture, right, of the tech health space, not only in your market, but in the region and in Africa as a whole, and how quickly it has evolved over the past 14 months.
It's been extremely fantastic hearing, that every digital health tech company across the country is really growing exponentially. I think we needed to see that, continent-wide scale of success across every single health tech digital health company, because then that validates that there is a general trend sweeping across the continent where people are opting to access healthcare services, much needed healthcare services on their mobile devices, electronically within their facilities. So I think that's really setting us up to fulfill the promise of this increased internet penetration, mobile penetration, digitization within healthcare. And I think, that's going to bring costs down, increase access, provide much more quality healthcare to people that never had it in the first place. I think it's, a great time for anybody in the health space with what the pandemic is transforming consumer behavior in favor of these digital health channels.
Davis, do you think these trends will be maintained? This consumer behavior and confidence will be maintained?
If any of our previous data, Rocket Health, just go by, with a lot of first-time consumers that come into telemedicine and digital health services, totally love the experience. They find it somewhat magical even, that they never quite go back to the way things used to be. The moment they experience the convenience of having to talk to a doctor via chat or video or voice call and having their lab samples picked up from home for testing and having their medicines delivered to them and having a doctor actually call them back to follow up if they've achieved their health outcomes, and all of this happen in the comfort of their homes. It's almost impossible to go back to the travel time and the long waiting rooms and having to bounce from one location to another location to get certain services which are not all centralized within a single facility, and have this, seamless integrated experience replace that. It's amazing what the customer experience is, especially if they can trust and also communicate to their friends and family. So we've seen that there is a lot of retention with first-time users, and I think this is a trend that's definitely going to continue.
Rita, I just want to give a classic scenario. One, where we're moving to regarding digitization of health. One feels, at one point, my watch may be able to, to tell if I'm going to get a stroke. My watch will be able to tell if I've gained an extra 3 pounds at the end of the week. And that information will be quickly relayed to whatever health service I'm subscribed to. That personally is rather very intrusive, right? So there are issues regarding trust around my data. How do you hope this will be managed?
That's a very good question, Arnold. Obviously, with digital comes a lot of data that is generated by all these user interactions on the various platforms. At Babylon Health, we have very strong policies and standards around customer data protection. It's very crucial for us, even as we're going into this world where we're seeing more and more users embracing digital health, to be able to set an environment which is very, which is safe for patients to believe that their information about their health, their records, their history is actually in the right hands and is being used by the intended people. So we have very, very strict policies and guidelines around that. But also what we've done with our service is we endeavor to mask customer data, personal identifiable data, such that if at all they're interacting with our interface, we ensure that maybe their NIDs are not easily able to be seen by maybe the person standing behind them, who would then get that information and use it to access maybe more information about that patient. We also have adopted policies globally around ensuring that patients consent to sharing data. So before they sign up for a service, they have to read the terms and references to that particular service that they're signing up for. And also they'll be told that this information is going to be used for various purposes. Do you agree? Do you subscribe to this? So that's very critical. And I'm glad you brought this up. I'd say for countries like in Africa, we're still trying to build those frameworks. But I think working with global entities or being part of a global brand, it really just pushes you to make sure that you're having the standards set up the right way. We've also seen that in Rwanda, and I think for those of you who've been in Africa for a while, you know that sometimes even people share pins, bank pins. They will say, hey, this is my mobile money pin. Could you go and help me withdraw, So there is still a lot of education around customer behavior, around protecting their own data so that they don't expose themselves in manners which would actually impact them in the future. But in terms of just building data, building algorithms around customer behavior, I think once the customer has consented to sharing the data, there's endless possibilities to what institutions or companies like ours can do to actually make their lives better. Of course, they have to consent to it, but we just want to be able to also tap into the opportunities and the insights that come with using digital platforms. Arnold, I'll just giving you that as an answer. I hope it resolves what your question was, but yeah, that's how we're approaching it from Babil.
Quite very extensive, and I will come back to it, but I just bringing back Dr. Jane into the conversation. Dr. Jane, what Rita has just explained regarding medical records, Helium is very good at doing medical records, at least going by your record as well. Medical records are seen as golden, especially that information, the selling of that information. We've seen cyber attacks in that space as well, just targeting individuals' medical health records. Now, how do I build the trust? How do you build the trust to ensure that someone logs on and gives you their personal information?
Of course, yeah, very, very good question, Arnold. And I think, it has a lot to do with being transparent, so saying exactly what it is that you're going to do with that data. And just like Rita explained, we also have terms and conditions so that when you're signing up, it's very clear what you're signing up for, what we're going to do with that data, what data we're collecting, how long we're going to have that data, making it very, very clear and getting the consent from the patient. So getting them to sign off, knowing that their data is going to be used. And also on the facility side, they have to do the same, and making sure that your companies, for example, with Helium, because we are headquartered out of Nigeria, we follow the NDPR, so the data protection regulation there. We also do the same here in Kenya, with the Data Protection Act and mirroring what is done globally as well. So making sure that you are compliant with the standards that exist in the markets you're operating, but also keeping up with global standards. And of course, just being very open when people do ask what it is that you want to do with my data. For example, if a patient wants access to their data, the data is actually theirs. I think we have to move away from this notion that the facility are the ones that hold the data, or we're the ones who have the data. So being open and transparent with patients, being open and transparent with facilities, let them know exactly what it is we're going to use with that data. And if there are questions asked, being available to answer those.
Dr. Jane, I want to stay with you there. Well, another thing is, diagnosis of patients. How do we ensure that if, I log onto your website, if I use that QR code in some places and I give you my symptoms, that I'm going to get the right medication for that? And in case I don't get the right medication for it, who is held liable?
Sure, yeah. So, it's very, when we think in terms of digital health, who's responsible? And we always say that the person who is the original referrer, so the doctor who you see, always maintains responsibility over their patient. So if you come on and you have a particular question, you're doing a teleconsultation, the doctor that you've seen, the information that you give you, that's what you will hold to. If you have particular questions that you don't feel have been answered well, that's where we're able to then give you a second opinion. You're able to seek advice from another doctor as well. And I think in terms of how do you trust that the data is secure, making sure that the platforms that we use, we regularly test them. You use the same kind of security that banks use, making sure that they're not being able to be broken into and that kind of thing. So I think also having that transparency where you allow patients to get choice, if they don't feel satisfied with one provider, that's not all you're stuck with on one platform. You have another provider who you can go to. But then again, you have to make sure that the doctors that you're getting onto the platforms are regulated doctors. So you don't just allow anybody onto the platform. They have to be licensed, regulated by whatever bodies in that country. So for example, here in Kenya, the Kenya Medical Practitioners and Dentists Council, making sure that all practitioners who are on your platforms are vetted by them, are licensed by them, they're governed by someone, so that at the end of the day, the medical advice that you're getting is sound, that you can rely on this advice. If it's in Nigeria, the same thing, that the bodies that govern there, so that that you're not just coming on and speaking to some chatbot. You actually have confidence in the providers that you are speaking to.
Davis, bring you back into the conversation. Have you gotten scenarios or cases where a patient has said they've been misdiagnosed by Rocket Health? And if so, how have you handled that? If in case that hasn't yet happened, how do you hope to handle that in case it happens?
Very interesting question. What we did find in the very early days of trying to deliver telemedicine services is that we noticed that a lot of doctors are very well trained for bedside care, but not well trained for website care. And we had to create a quality assurance mechanism and kind of a retraining module that would allow us to take in these doctors that we have hired and have them retrained to be as efficient on a telemedicine call or a video call, so that we could be able to deliver the same quality, even quality outcomes than before. So what has had to happen is that one did get accredited as a continuous professional development member within the country. So meaning that we provide CPD sessions that allow us to provide points to medical professionals that work with us that go through our quality assurance program. But then again, we also have a lot of patient record reviews. So we'll go through the different patient records, the different patient interactions. We'll learn as much from that experience. We'll build a lot of management protocols internally so that we are all in sync about what the practices are. We'll all have external trainers and quality assurance experts. So they'll come and look at what some of our prescription patterns or diagnosis patterns look like. Another great thing is that we have the oversight of some of our insurance partners that do cover the medical cost of our clients. So they also get to review some of these things. And that helps refine everybody in the process to make sure that we don't arrive at any cases of misdiagnosis. Fortunately, we haven't had any such case, but there's always room for improvement where we can deliver better quality care at a more affordable price for all these new conditions that we're seeing through our telemedicine service. So we're always looking out for how we can make this better for everybody that comes to this experience. And I think after 9 years of doing this, I think we have a mechanism and a system that is repeatable and delivers fantastic results.
David, staying with you there, there's the issue of pushback coming in from medical professionals, and I don't want us to get into the regulators. That is going to be a conversation a little bit later on. But pushback from medical professionals, I've read somewhere where medical professionals are saying, this is taking money out of our pockets. And you have scenarios whereby, someone goes up to the website, goes up to your QR codes, and they are speaking to a nurse. The nurses are cheaper than doctors. And the nurse is able to tell them or to diagnose them with what's happening for a condition previously where they had to go into the clinics, and then for those 15 minutes they're able to see a doctor, but then the doctor gets paid for that time. How are you able to deal with that pushback from medical professionals? Because we've seen what has happened with opticians and with the regulations that have been passed by different countries regarding that. How are you able to deal with some professionals, or majority of the professionals in the medical world, who are pushing back against telemedicine and this e-health that has cropped up?
Yeah, so very interesting thing. Very early on in the days of telemedicine, there was a lot of skepticism whether telemedicine could be able to sufficiently diagnose certain conditions. And we've found out over time that 70% of outpatient conditions can be accurately diagnosed by just taking proper history and comprehensive history. And I think a medical professional will tell you that, the strongest skill set you could possibly have is history taking. I think if you have a team that becomes very good at that, then it becomes very straightforward on how you can diagnose certain outpatient conditions, normally when ailments people go into the clinic and the hospital for. I think what then becomes really important is to train the team to discern what kind of conditions do we need to escalate to a specialist or escalate to a physical examination. And that's where I think, advanced skills really do come in. And then also beyond that initial interaction, the first interaction at Rocket Health is with a medical doctor. Your follow-up interaction could be with a different cadre that is, capable at that point in, say, a clinical officer or a nurse to do the follow-up. But anything else would have to be escalated to a specialist or to whoever is in a better position to handle that particular scenario.
So how do you know that this has to be escalated?
Yeah, so there are different kinds of protocols that we would follow. If we get more information from a physical examination, meaning that we need to take certain vitals from you as an individual, maybe we're going to need to listen to your heart sounds, your chest sounds, something like that would automatically get escalated for a physical review. So we do have a chain of clinics that will then set up an appointment with you, and you can be able to walk in at a specific time. Your history is already taken. You're able to save time, and you're able to see a specialist that will be able to then carry on your care beyond the complexity of what can be handled over the phone. So it's really on a case basis, just training the teams to discern what needs specialist intervention, physical intervention, and having that still just go through the healthcare value chain as we know it.
Bring you back into the conversation, and just, to piggyback off that question to Davis, and I'm sure you've had these conversations with fellow doctors as well. They feel like there's going to be a time when machines, AI technology, replaces them, and that's the reason for pushing back against this. Are they right to be fearful that this is going to take away bread from their plates?
So I see doctors and AI being kind of like the most powerful collaboration that you can create. And we've done 2 pilot studies where we have combined lower cadre healthcare professionals with AI tools. And we've seen that, in 77% of the cases, that a clinical officer or a nurse partnered with an AI tool can deliver a consultation as good as if it was a doctor on their own. And we're going to see a new evolution where AI is seen as a key partner in making sure that we get more accurate diagnosis, that we interpret lab results better, that we can do to prescriptions, to lab tests, history, that gives us the best possible care plan for a certain kind of patient. So very personalized treatment plans that deliver the highest possible outcomes, purely driven by a collaboration between AI that is using high quality data from thousands or hundreds of thousands of cases from around the world, with also the personal judgment and professional skill capacity that the medical profession has built over time and over years and through education. So I see it as a very powerful collaboration where the doctor that use AI will be the best doctors in the market and ultimately deliver better outcomes than those that don't.
Dr. Jane, very similar to what I've just asked Davis. When you're speaking to your fellow medical professionals, they feel like AI technology is going to replace them. Are they right to feel like this is going to take bread away from their plate?
Yeah, I mean, I think, when there's something new, there's always that fear. It's the fear of the unknown, isn't it? And it's like, we're going to have robots taking our place. People will no longer need to come in and see us with our white coats and stethoscopes. But just like Davis has said, I think, when we introduce elements like AI and big data, and we talk about this, you need a lot of data. And by no means are they 100% and without error. So, for example, if you're looking at data that's collected by AI and it's looking like at a lesion, so let's say a mark on your arm, and you're trying to evaluate if there's skin cancer. If there was a ruler there measuring, AI would pick that ruler as part of the lesion, but you with your naked eye as a doctor, you'd be able to tell that's just a ruler measuring. So it has to be collaboration, it's not one or the other. I would say we need to embrace technology, because if you're not getting with the times, then for sure you will be left behind. I think a lot has been said to discredit, digital health and that fear, but I think if we start to embrace it as we have seen in the past year with COVID, a lot more can be done. And at the end of the day, you have to ask yourself, what really is the outcome that we're heading towards? What really is important? And at the end of the day, it's patient care. If me using AI, if me using clinical-based decision-making tools that are tech-based will help me deliver better care to my patient, then why wouldn't I want to do that? So at the end of the day, I think as healthcare workers, we need to ask ourselves, what is it that we want to see? We want to see better patient care. We want to see improved quality of care. You want wait times to be decreased. So that therefore, if I'm going to use, digital health to improve that, reduce the cost of care to my patient, then why wouldn't I want that? And I think when we start to even embrace digital health technology in medical education, I think when we look across our medical schools, how many of us were taught about digital health? We probably did like a few assignments on a computer, but that was it. But if we start now, integrating digital health into the curriculums, and people begin to be a bit more open-minded. Of course, those are older, have been in the system for years, might be more resistant to it, but change is inevitable. And I think the more we start to talk about it, bring it into the curriculums, bring it into the way of life, then it'll become more accepted.
Rita, bring you in. You're going to wrap up this conversation for us, and unfortunately, we're running out of time. I just want you to speak on what you think the next 5 years will look like for the tech health industry.
Thanks, and this is such an interesting conversation. I'm glad I agree with both Davis and Jane. I think what they just said about digital platforms replacing doctors isn't necessarily true, but it's more a collaborative effort. So where do we see ourselves in 5 years? What do you think that looks like? Well, I think for sure we're going to continue to see innovations in this space. One thing that COVID has taught us is we cannot just stick to our 10-year strategies or whatever that looked like at the start of 2020. You know, people had these great ideas of what 2020 is going to look like. People were coming up with their plans. Companies were strategizing, going for retreats. But then 3 months into the year, everything just fell out, you know? So I think for sure one thing we've learned is innovate, adapt quickly, make sure that you're understanding how the consumer behaviors are changing. Wherever there's a pain point, then seek a solution. Technology, the good thing about technology these days is it's getting better and better. So what took typically several months to build and deploy and test out can now be done in just a couple of days, you know, because everyone is trying to innovate and make things more efficient and more much better. So in terms of the health space, what I think is, especially in Africa and in our countries, we're going to see more people embrace technology for our health. We're going to see more, I would say, more applications or platforms that are geared towards improving well-being, holistic lifestyle, just making sure that people don't reach a point when they're sick before they can seek care, but rather what can they do to prevent and live a healthy lifestyle, you know? That way they're having a quality life or an all-around quality life. I'm also saying that maybe with more doctors coming on board, I believe our technologies are going to be even, you know, more, you know, I look forward to the future. Let me just say I look forward to the future. Yeah, so yeah, in a nutshell, that's what
Quite the optimism from the panel. I wish we could really continue this conversation, but unfortunately we've run out of time. I hope to chat to each of you individually in the near future as well. Now, Rita Kanyana, she is the Senior Strategy and Operations Lead at Babylon Health Rwanda. We also want to thank Dr. Jane Kula, she's the Country Manager for Helium Kenya, and Dr. Davis Musinguzi from Medical Concierge, the makers of Rocket Health. Now, as always, you can tweet us at CNBC Africa to be part of this conversation, or you could tweet me directly at The Real Quizzer. Have a great rest of your day.